Now, if we look at some cross sections of the spinal cord all the way to the brainstem, we will look at different levels and see how things traveled. So, if we start again by our touch, and right today, by touch and proprioception, we know the order that it goes from first cell body, second cell body, third cell body. First and third is always the same. For it goes from dorsal root ganglion all the way to either nucleus gracilis or nucleus cunatus, depending on where you are in the body, if you're in the feet or if you're in the arms area. And then third synapse will be in the VPL for the body, in the thalamus. So we know here second is in the medulla, third is in the thalamus, and then first was always in the dorsal root ganglion. And we will just talk about how this travels in different spinal levels. If we talk about touch and proprioception, so this was body. If we talk about in face, we know it will be in the trigeminal ganglion, V1, V2, V3. It will go to the principal or chief nucleus of trigeminal, go through the trigeminal thalamic tract, and this was medial lemniscus. Go through trigeminal thalamic tract to the VPM. Similarly, if we talk about our pain and temperature, do that here. Pain and temperature for the body and face. So first cell body, second cell body, third cell body. It's similar in that body pain and temperature. It starts in the dorsal root ganglion, will travel through the dorsolateral sulcus, go to substantia gelatinosa in the dorsal horn, travel via spinal thalamic tract to the VPL. And then for the face, once again, trigeminal ganglion. Now it will have to go down, descend to the spinal trigeminal ganglion. Trigeminal nucleus, go through the trigeminal thalamic tract to the VPM. So now let's look at some cross sections right here. So if we zoom in, so first we're at spinal level. We can see the fasciculus gracilis in the middle, and then we have fasciculus cunatus out here. So fasciculus gracilis, we know here, if we see fasciculus cunatus, is that we are at some type of level T6 and above, because we only saw fasciculus gracilis. If this whole thing was 1, that meant we were T6 and below. So here we're T6 and above. They're both coming together in the spinal cord, and we know, looking back, that it will synapse in the medulla, at the level of medulla, in nucleus gracilis or nucleus cunatus, and that's after that it always decussates or crosses over. Now we're at the level of medulla right here. A few things we can look at. We have some pyramidal tracts on the bottom. So right here in the arrows are representing, the arrows coming in can be your fasciculus gracilis and cunatus, fasciculus gracilis and fasciculus cunatus, and they will synapse here. So now here, the one I'm shading is my nucleus gracilis, and then what I will shade here will be my nucleus cunatus. So this is, now I am at my second cell body, because the first cell body was, like we know, in the dorsal root ganglion. So I went from dorsal root ganglion, either through gracilis or cunatus, and then it will synapse right here at the nucleus gracilis or nucleus cunatus. After that, it will travel through the IAF and oh, I should be doing in blue because this is touch. So IAF, it will cross over into the medial lemniscus. So this is our medial lemniscus system, ML. Next we keep going, and so the yellow area that it's signifying is my medial meniscus. So it kind of synapsed. Now we're going upper towards the brain, so we're more rostral towards closer to the pons and the medulla. Still at the medulla, but we see these inferior olives right here. Inferior olivar nucleus, and then we see the fourth ventricle up top, and medial lemniscus, where it's crossed over. It will cross over and travel up to the thalamus. As we keep going, now we're at the level of pons. So this is easier to remember because the picture was better. You would have some type of these stripes or the bacon strips right here, and the medial and the meniscus is basically slipped on this greasy bacon because now the whole homunculus has been switched over. But still, where the yellow is, my medial meniscus is at that location. It's traveling or crossing over. What else do we see here? We see the fourth ventricle once again, and then a few other things. So we had the bacon down there, and that's called bacon and eggs. Then we have these two eggs here. The more lateral egg, we'll call that the primary egg, or the principal nucleus, or the chief nucleus sensory that we need for our face. So I know right now we're following the body through the medial meniscus, but it's nice to know that the pons has the bacon and egg. And the bacon, or right above the bacon, is my medial meniscus, and my egg is my chief nucleus. Right? So that is where my second cell will synapse here in the chief primary nucleus. Whereas we're still, as in the, we already synapsed for the medial meniscus in the nucleus gracilis and cunatus. We keep going. Now we're at the Russian man section. So we know we're at the midbrain. Russian man has a midbrain. We have the intrapendicular fossa right in the middle. That's where cranial oculomotor exits. Then we have the green arrows are representing right here the medial meniscus again as it's traveling. Then we have the cerebral aqueduct up top that's connecting our third and fourth ventricles. And then we have these cerebellar peduncles. Cerebral peduncles, or the big motors. And I just like to draw a little the caveman for anyone that doesn't see it, because I never saw it for a long time. So we'll just go with, here's some eyes, here's his nose, here's his big beard. He has some ears or ear muffs. He has a big hat. The cerebral aqueduct is his big hat, keeps him cold. Has some water in it, or whatever you want to think about. He also has this arm, which will be helpful. So he has an arm, he has the elbow portion, and then he has this forearm, which he likes to flex. So that will be something should help us later on. We keep going. Now we're at the thalamus, and we know what happens at the thalamus. Thalamus is where our third cell bodies are. So here, the colored one is your VPL, and then this little white little dot is always your VPM for the face. So now we have synapsed. So we came from the medial meniscus, and now we are synapsed in PLIC. From the PLIC, we'll basically go through, we synapsed at VPL, and now through the PLIC, we'll go to the cerebral cortex and follow the homunculus. So this is at third cell bodies. And finally, looking at the face, or the trigeminal example, here we have the trigeminal ganglion, V1, V2, V3. What's happening here is that a lot of things, but just follow me along. So we have our touch and proprioception that came in. First synapse, trigeminal ganglion. Second is right here at the chief sensory nucleus, which is kind of as soon as you come into the pons, and then it crosses over and goes to the VPM. Another example here, I'll just do that right now, is if you have pain that happens here. Sorry, what am I doing? Trying to do an arrow or some type of fire. So if you have pain that comes in, same thing, trigeminal ganglion, but now it has to descend. So that is the whole problem. It has to descend synapse at that spinal trigeminal nucleus, decussate and cross over, and synapse, same thing, VPM. So now if we look at this example, we can see in the arrow the spinal, and this blue keeps popping up, the principal chief nucleus of trigeminal, or chief nucleus of trigeminal, and we can see the medial ulnar meniscus right here. We see the pons, and then we keep going. It will come synapse in the VPM, which is for the face, not the VPL, which is for the body. So we'll come synapse here in the VPM, and then from the VPN go through the posterior PLIC to the cerebral cortex. So that was touch and proprioception for our in these cross sections. And now we will do pain and temperature, like we talked about. So reviewing once again, real quick, pain and temperature starts for the body in dorsal root ganglion. Second, always in the substantia gelatinosa. Third, always VPL for the body. So in the face, trigeminal ganglion, like I just showed you, will go down into the spinal trigeminal nucleus and then go to the VPM. So now let's do pain and temperature. So first, as always, is dorsal root ganglion for the body. Will come down into the substantia gelatinosa, which is this guy right here, this upside down U, with the substantia gelatinosa. Write that here too, substantia gelatinosa. So that's already my second one. So I'm already here at my second cell body. It will synapse, go through the anterior white commissure, and travel up as spinal thalamic tract. So our major thing in pain and temperature for the body is to follow the spinal thalamic tract. Spinal thalamic tract and the substantia gelatinosa and our dorsal horn, I'm trying to think, the spinal trigeminal nucleus and other components, they look similar and they act similar as well. So what they're trying to show you here is that when from the first cell body, dorsal root ganglion for the body comes in for pain and temperature, it synapses right here at the substantia gelatinosa. So this is second cell body for pain in the body. Whereas if you have pain in the face, the first cell bodies is trigeminal ganglion, which we all know, and then we know that the second synapse is right here for the face, and we know this as to be the spinal trigeminal nucleus. So that's a similarity, is that they look like they're in the same place. As we keep following our spinal thalamic as it's going up, ascending, we now can see it right here at the level of medulla. so it's right above the pons. Then we get to the inferior olives. Then we get to our midbrain, basically, mesencephalon, the Russian man. And the Russian man, now we know we will have spinal thalamic right here in his forearms. So he likes to flex or his forearm, and that's spinal thalamic. Still going up to the thalamus, whereas this guy right here was our medial lemniscus. So very close together. His arm medial lemniscus, his forearm is spinal thalamic. Keeps traveling, and finally we're still in spinal. Now we're at the level of pons. We're still at the spinal thalamic nucleus right here. Now we are finally at the thalamus, where the third cell body's synapse after substantia gelatinosa. Here we can see the small guy VPM and then big guy VPL. And this is where the synapse, then they cross over, go into the PLIC and finally into the cerebral cortex. So this example is a good example to show you how it travels. So we can see here we have V1, V2, V3. The cell bodies go into trigeminal ganglion, the first synapse. They travel, but once they get inside the pons, it has to descend to get to synapse at the spinal trigeminal nucleus, and then it will go into the trigeminal thalamic tract to the VPM, which is medial, then the VPL. Synapse there go through the PLIC to whichever part of the homunculus we're talking about regarding the face or the lips. Yeah, that everything should cover there. We can just do a quick overview, some of the images, just do a short review. So here we can see we have our medial lemniscus system, and we know medial lemniscus system stands for the touch and proprioception for the body. So here we're doing, if we get touch from the legs, we are traveling here in fasciculus crucilis. If we get it from the arm, here we travel through fasciculus cuneatus. Like I said, it will only innervate at the level right here. We have nucleus cuneatus and nucleus crucilis. They cross over, become the medial lemniscus, and will innervate the body at the VPL. If we have the face, it will go through the trigeminal ganglion, synapse at the same level at the chief sensory nucleus, cross over, go to the VPM. No notes. Okay, the second picture right here is spinal thalamic. So here we know that we said for pain, if we come from the legs, still synapse is dorsal ganglion, but now second order is already here. We're not going all the way to our medulla like we did over here. We will synapse at the same level, cross over, and now we are at the spinal thalamic tract, go up to the third at the VPL. If we are in the face, we will go same thing, trigeminal, go down to the spinal trigeminal nucleus, cross over, go up, synapse third at the VPM. So I hope this is making sense on the main thing that the face, the pain face, travels down, descends, descend to spinal, so it descends down to the spinal trigeminal nucleus, whereas the pain in the body, synapse at the same level, and then the only thing is that for touch of the face, it will synapse at the chief or at the same level, but I think I was trying to talk about the touch for the body will synapse only at the medulla. Okay, let's just finish it up. You can see right here. Now, once again, we have the medial lemniscus. They give a better example. We can see fasciculus gracilis traveling, fasciculus cuneatus traveling. Once they are at the medulla, the synapses. This is my second um, cell body for touch and proprioception. It travels as medial lemniscus. Up everything goes to the VPL for the body. And then through the PLIC, which are all these lines, these highways, it will go to the homunculus. And like I said, we have the legs right here. In the middle, we have the arm right here, and we have the face on the side. If we talk about the face, once again, trigeminal will synapse at the same level, chief sensory crossover, go to the VPM. And then I think this is once again pain, or sorry, I don't know what this one's talking about, but here's trigeminal. We already talked about that one. Trigeminal, the problem it has to go down for the spinal trigeminal for pain. And finally, last thing that's very important in dentistry is the gate control theory of modulation. And gate control theory of modulation just says that we have the pressure fibers, which are A alpha, and they are larger or felt at higher intensity, higher rate than the A delta, small unmyelinated or almost unmyelinated for the pain. So what happens is that the small unmyelinated for pain and temperature, whereas the large myelinated for pressure and vibration, they help us in controlling perception of pain. So when your patient has to get an injection, most dentists will pull the cheek or vibrate the cheek. But now there's another product called Vibrogen. It just snaps right onto your injection onto the syringe, and it does a vibration because the patient is able to the pressure basically overtakes the pain that the patient will feel with the needle poking them. So the gate control theory modulation says that the A alpha collaterals synapse at the substantia gelatinosa, and they stop the pain perception by inhibiting the pathway at the spinal cord brainstem level of AD. So we know the AB are the touch proprioceptions and the AD are mechanoreceptors for pain. So the AB synapse and stop the pain of AD. So our pressure, so pulling the cheek will overtake the pain receptors, and then the patient won't feel as much of the needle. Thank you very much for watching.